or mild. Okay, so seborrheic dermatitis. Which type of lesion is this? You can see here around the oral cavity. So it is perioral around the oral cavity dermatitis. Perioral dermatitis. So dermatitis is a red rash that cycles the mouth. The skin can be scaly, dry, and flasky with swollen and plum bumps called papules. Perioral dermatitis can look like acne and is often mistaken for it. Okay, so perioral dermatitis. Which type of lesion is this? See. So acne fulminans. Okay, so acne fulminans. So this is emergency. Acute fulminans seen in adolescents, boys. Severe acne associated with fever, arthritis, and vasculitis. Okay, fever, arthritis, and vasculitis. Acne fulminans. Okay, what type of lesion is this? Milia. Okay, some milia. Small cyst containing keratin, tiny pearly white bumps just under the surface of the skin, and these are skin colored. And these are neonatal milia. You can see here. These are neonatal milia. Which type of lesion is this? Infantile acne. Infantile acne. Okay. Okay, so what type of lesion is this? Mongolian spot. Mongolian spot. Congenital dermamelanocytosis, birthmark that is flat blue or blue gray. They appear at birth or in the first few weeks of life. Okay. So now, what type of lesion is this? So erythema toxicum neonatorum. Erythema toxicum neonatorum. Okay, erythema toxicum neonatorum may be present at birth, but more often appears during the second or third day of life. Erythematous 2 to 3 mm macules and plugs that evolve into the pustules. Each pustule surrounded by a blotchy area of the eczema, leading to what is classically described as a flea-bitten appearance. Palms and soles are not involved. Not involved. Okay, erythema toxicum neonatorum. What type of lesion is this? So, transient neonatal pustular melanosis. Transient neonatal pustular melanosis. Okay. Transient neonatal pustular melanosis, benign pustular condition. Key clinical features: pustule present at birth, no new lesions after birth, no systemic abnormality characterized by pustules, and no erythematous base. Okay. What type of lesion is this? Strawberry colored. So, strawberry nevus. Infantile hemangioma, also called infantile hemangioma, benign vascular tumor, clinical soft vascular swelling is found, typically solitary, mostly head and neck region, 60% found, and resolve spontaneously in time, can leave a residual mark. Okay, what type of lesion is this? Nevus simplex. Nevus simplex is most common vascular nevus. 50% of neonates due to dermal capillary dilation equally affects male and female infants. It presents at birth as a pink or red patch, also called salmon patch. Stroke bite when on the nape of the neck, angel skins west on the glabella and eyelids. Okay. Which type of lesion is this? Neonatal phlemus. Nevus phlemus. Okay, nevus phlemus. You can see here. Okay, so nevus phlemus, a port wine stand and capillary vascular malformation present a pink, red, or purple patches, unlike nevus simplex. Okay, and this is nevus simplex. Okay. And this is a port wine colored. Okay, color vary from purple, pink, okay, and red. Okay, and so it tends to be unilateral, often persisting, darkening, and thickening with increasing age. Okay, so now which type of lesion is this? Infantile acropustulosis. Infantile acropustulosis, itchy, uncomfortable skin condition affecting palm and soles. Temporary condition comes and goes, usually disappears by age of 3 years. Heal with small temporary pigmented areas. Okay. Which type of lesion is this? Hand, foot, and mouth disease. Okay, so mild, short-lasting viral infections, most commonly associated with Coxsackie virus, mostly affect children under age of 5. 95% present fever, headache, sore throat, and malaise alongside the rash. Lesion on the dorsal and palmar surface of the hand and feet. Small, painful vesicles and ulcers in and around the mouth, palate, and pharynx. Okay, so hand, foot, mouth disease, Coxsackie virus infection. Which type of lesion is this? Slapped cheek, parvo virus B19. Okay, slapped erythema infectiosum. Okay, also called slapped cheek syndrome. Okay, common childhood viral infection caused by parvovirus B19. Mild fever and headache at first. A rash appears a few days later with firm red cheeks, which feel burning hot and last 2 to 4 days, followed by pink rash on the limbs and sometimes the trunk. This develops a lace-like a network pattern. Okay. Which type of lesion is this? Striae gravidarum. Striae gravidarum. Okay. So striae gravidarum are atrophic linear scar that represents one of the most common connective tissue changes during pregnancy. Okay, so striae gravidarum, and this is linea alba or linea nigra. So it's a dark vertical line running down your belly, also called a pregnancy line, called alba when color is white. This is linea nigra, okay, because line is white, black, dark, okay, line is dark, so this is nigra. What type of lesion is this? Polymorphic eruption of pregnancy, okay. This is striae gravidarum, and this is a polymorphic eruption of pregnancy, okay, so also called PUPPP, or pruritic articulated papules and plugs of pregnancy, okay. Which type of lesion is this? Prurigo of pregnancy, prurigo of pregnancy, you can see here, okay. So prurigo of pregnancy, benign non-specific pruritic itchy papular rash that arises during pregnancy, appears in the second and third trimester, resolves after delivery, okay. And what type of lesion is this? Pemphigoid gestation is C. Pemphigoid blisters are filled with clear fluid. So pemphigoid gestation is a rare characteristic bullous eruption associated with pregnancy. Pregnancy starts in mid-pregnancy and appears as a generalized, intensely itchy rash, remits after delivery, but often occurs in subsequent pregnancies. Refers for specialist management. Okay. So what type of lesion is this? So these are pemphigus vulgaris. Okay. Pemphigus vulgaris. Okay, so pemphigus will associate with other autoimmune disorders like myasthenia gravis, skin lesion, thin-walled, flaccid blisters filled with a clear fluid, easily rupture, causing itching and painful erosions. Okay, vulgars are easily rupture. Okay, vulgars are easily ruptured. Okay, so pemphigus vulgaris. What type of lesion is this? So this is bullous pemphigoid. Bullous pemphigoid is autoimmune disorder. Starts with an itchy, rash, large tense blisters arise on a red normal skin of the limbs, trunk and flexures. You can see here tensed. Easily ruptured vulgaris. Okay, and tense are bullous pemphigoid. What type of lesion is this? Dermatitis herpetiformis. This is dermatitis herpetiformis, and this is prurigo of pregnancy. Okay, C. It's pinkish in color. And C. Okay, so this is dermatitis herpetiformis, common in celiac disease patients. So itchy vesicular skin rash on the elbows, extensor surfaces, knees, buttocks, and scalp, often with excoriation, closely related to celiac disease. Okay, so dermatitis herpetiformis. Which type of lesion is this? So, epidermolysis bullosa. Epidermolysis bullosa. Okay. So is a group of genetically inherited diseases characterized by blistering on minimal trauma. Blistering caused by friction, is mild and limited to hands and feet. Okay, and this is erythema nodosum. Okay, and tender erythematous nodules 1 to 5 centimeter in diameter on external surface of the limbs, especially shins, plus minus ankles and wrist. Okay, what type of lesion is this? Target lesion. So erythema multiforme. Yeah, so immune mediated disease characterized by target lesions on the hand and feet. Okay, so erythema multiforme, target lesions. What type of lesion is this? Erythroderma. Also called exfoliative dermatitis, erythema affecting more than 90% of skin surface, potentially fatal. This is potentially fatal, erythroderma. Okay, so these are emergencies of derma. What type of lesion is this? Palmar erythema. Okay, so generalized reddening of the palms, symmetrical, both hands, non-painful, non-itchy, slightly warm. They are common in hyperthyroidism and in pregnancy. Okay. What type of lesion is this? So chilblains. Okay. So chilblains triggers exposure to damp, cold, non-freezing localized swelling, blanchable red papule discoloration. Okay, so chilblains. Okay. What type of lesion is this? You can see here. Okay, so erythema abyegin. Okay, and this is erythema abyegin, reticular pigmented erythema due to heat-induced damage. Okay, those who sit in front of heaters, okay, so they are more prone to have erythema abyegin. What type of lesion is this? You can see here. Stevens-Johnson syndrome. Okay, so rare life-threatening drug-induced hypersensitivity reaction, unpredictable, involves skin and mucous membrane, widespread painful areas of epidermal. Detachment. Stevens-Johnson syndrome. What type of lesion is this? Toxic epidermal necrolysis. Okay, TENS, a severe form of Stevens-Johnson syndrome, and it is also a rare life-threatening drug-induced hypersensitive reaction, unpredictable, involves skin and mucous membrane, widespread painful areas of the epidermal detachment. What type of lesion is this? This is mole. Okay, this is mole. Nevus or mole, common benign skin lesion due to local proliferation of pigment called brown or black melanocytic nevus, contains the pigment melanin. And what type of lesion is this? This patch. Capsulated spot. Okay. This is also congenital. Light to dark brown pigmented birthmarks that commonly appear on a newborn's skin. Spots can change in size and number over time. More than 6 scaphoid spots can be a sign of underlying genetic condition like neurofibromatosis type 1. Okay. What type of lesion is this? This is junctional mole. Okay, junctional. Type of nail mole found on the junction border between the epidermis outer and the dermis inner layer of the skin. These moles may be colored and slightly raised. Junctional mole. Now, what type of lesion is this? This is intradermal mole. Intradermal. Okay. Nets of melanocytes found in the dermal layer of the skin. Intradermal neva are typically raised dome-shaped papules. Okay, you can see here. Okay, skin color, dermal of the skin. What type of lesion is this? This is two colored. So this is compound mole. Compound nevus has nets of nevus cells at the epidermal and dermal junction as well as within the dermis. A central rest area surrounded by a flat patch. Okay, surrounded by a flat patch and center is rest. So compound nevus, compound mole. Okay, so what type of lesion is this? This is epidermoid cyst. Epidermoid cyst. Okay, benign cyst derived from upper portion of the hair follicle encapsulated in a thin layer of epidermis like epithelium, has a punctum on top. You can see here black punctum on the top. Epidermoid cysts are typically filled with keratin and lipid rich debris. Which type of lesion is this? This is lipoma under the skin. Very common non-cancerous tumor of flat cells slowly growing under the skin in the subcutaneous tissue. What type of lesion is this? This is dermoid cyst. You can see here in the little finger, dermoid cyst. So dermoid cysts are made up of epidermal and dermal components, keratinocytes, hair follicles, and the hair and sweat glands. The cyst is usually a solitary form, duff-like lump, 0.5 to 6 centimeter in diameter. Can be of this size. What type of lesion is this? This is keloid scar. Keloid scar. Okay, keloid scar and enlarged raised scar that can be a pink red skin color or darker than the surrounding skin. Then can develop some very minor skin damage such as an acne, spot or a piercing, and spread beyond the original area of the skin damage. So keloid scar. And what is this? This is hypertrophic scar. Okay, hypertrophic. These are keloid. These are hypertrophic. So hypertrophic scar is a thick raised scar that's an abnormal response to wound healing. Does not extend beyond the margins of wound. Keloid scar is spread beyond the original area. Okay, spread beyond the original area, but hypertrophic scar do not. Okay, extend beyond the margins of wound. What type of lesion is this? This is malignant melanoma. Okay, A, B, C, D, E of the melanoma. So it's a potentially serious type of skin cancer in which there is uncontrolled growth of melanocytes, pigment cells. The first sign of melanoma is usually an unusual looking freckle or mole. Okay, so this is malignant melanoma. What type of lesion is this? So this is basal cell carcinoma. It starts as a small pearly nodule plus minor surface telangiectasia and rolled margins. What type of lesion is this? Can see here. So actinic keratosis. Actinic keratosis, precancerous scaly spore found on sun-damaged skin early from a cutaneous squamous cell carcinoma, solitary often multiple keratosis, a flat or thickened papule or plugs, white or yellow scoliovarty or horny surface. So these are actinic keratosis. What type of lesion is this? This is Bowen's disease. Bowen's disease, you can see here. Okay, so Bowen's disease is squamous cell carcinoma in situ. No evidence of dermal invasion, typically on lower leg in elderly women, and flat edge, pink or slightly pigmented scalp papules, less than 5 centimeter in diameter. So Bowen's disease look like that. Okay, common in older age, elderly women. Okay, and typically on lower legs. Okay, and what type of lesion is this? This is squamous cell carcinoma. Okay, this is actinic keratosis, and this is squamous cell carcinoma. Okay. So squamous cell carcinoma, second most common skin cancer after basal cell carcinoma, usually develops in skin exposed to sun. Okay, and may start within an actinic and solar keratosis or de novo. Okay, what type of lesion is this? So this is lentigo maligna. Okay, it is not like a melanoma, malignant melanoma. Okay, a malignant melanoma looks like this, and this is lentigo maligna. Okay, so that is difference. Lentigo maligna is an early form of melanoma in which the malignant cells are confined to the tissue of the origin, the epidermis. Hence, it is often reported as an in situ melanoma. It occurs in sun-damaged skin, so it's generally found on the surface and on the face or neck, particularly the nose and cheeks. Okay, so it is here. It is on the cheek. Okay, so I tried my very best to make video on derma slides. So